Leukemia is a type of blood cancer that affects many people around the world. According to the American Cancer Society, leukemia is expected to cause about 23,710 deaths and account for about 3% of all new cancer cases in the U.S. in 2023. In this video, we'll explain everything you need to know about leukemia, its causes, symptoms, diagnosis, and treatment. Let's first start with what is leukemia. Leukemia is a cancer of the blood cells that starts in the bone marrow, which is the soft tissue inside your bones where blood cells are made. Normally, your bone marrow produces different types of blood cells, such as red blood cells that carry oxygen, white blood cells that fight infections, and platelets that help your blood clot. These blood cells grow and mature in a controlled way, as your body needs them. However, in leukemia, some of the blood cells become abnormal and start to grow and divide faster than normal. These abnormal cells are called leukemia cells. They do not function properly, and they crowd out the healthy blood cells in the bone marrow and in the bloodstream. This can lead to problems such as anemia, low red blood cell count, infections, low white blood cell count, and bleeding, low platelet count. There are many types of leukemia, depending on the type of blood cell that becomes cancerous and how fast it grows. Some types of leukemia are more common in children, while others are more common in adults. Some types are acute, which means they develop quickly and need urgent treatment, and other types are chronic, which means they develop slowly and may not cause symptoms for a long time. But the most common types are: Number 1. Acute lymphoblastic leukemia. This type affects immature white blood cells called lymphocytes. It is the most common type of leukemia in children, but it can also affect adults. Number 2. Acute myeloid leukemia. This type affects immature white blood cells called myeloid cells. It can affect both children and adults. Number 3. Chronic lymphocytic leukemia. This type affects mature lymphocytes. It is the most common type of leukemia in adults over 50 years old. It usually grows slowly and may not need treatment for a long time. Number 4. Chronic myeloid leukemia. This type affects mature myeloid cells. It is more common in adults than in children. It usually grows slowly at first, but it can become more aggressive over time. Now, what causes leukemia? The exact cause of leukemia is not known, but it is thought to be a result of genetic and environmental factors. Genetic factors are changes or mutations in the DNA of the blood cells that make them grow abnormally. These mutations can be inherited from your parents or acquired during your lifetime due to exposure to radiation, chemicals, or viruses. So, what are the symptoms of leukemia? The symptoms of leukemia depend on the type of leukemia you have, how fast it grows, and how it affects your blood cells and other organs. Some people with chronic leukemia may not have any symptoms for a long time, while others with acute leukemia may have sudden and severe symptoms. Generally, the most common symptoms of leukemia are: Number 1. Fatigue. You may feel tired or weak due to low red blood cell count, anemia. Number 2. Fever or infections. You may have frequent or severe infections due to low white blood cell count. Number 3. Bleeding or bruising. You may bleed or bruise easily due to low platelet count. Number 4. Swollen lymph nodes. You may have swollen glands in your neck, armpits, or groin due to accumulation of leukemia cells in your lymphatic system. Number 5. Enlarged spleen or liver. You may have pain or discomfort in your upper left abdomen due to enlargement of your spleen or liver due to accumulation of leukemia cells in these organs. Number 6. Bone pain. You may have pain in your bones or joints due to pressure from the growing leukemia cells in your bone marrow. Number 7. Night sweats. You may sweat excessively at night due to fever or hormonal changes caused by leukemia. Number 8. Weight loss. You may lose weight without trying due to loss of appetite or increased metabolism caused by leukemia. How is leukemia diagnosed? If you have symptoms of leukemia or abnormal blood tests, Your doctor will do a physical exam and ask you about your medical history and family history. Your doctor will also order some tests to confirm the diagnosis and determine the type and extent of your leukemia. Some of these tests are: Number 1. Blood tests. These tests measure the number and appearance of your blood cells and check for certain markers or proteins on the surface of the leukemia cells. Number 2. Bone marrow biopsy. This test involves taking a small sample of your bone marrow, usually from your hip bone, using a needle. The sample is then examined under a microscope to look for leukemia cells and other abnormalities. Number 3. Lumbar puncture. This test involves taking a sample of your cerebrospinal fluid, which is the fluid that surrounds your brain and spinal cord, using a needle inserted into your lower back. The sample is then checked for leukemia cells and other signs of infection or inflammation. This test can determine if your leukemia has spread to your central nervous system. Number 4. Imaging tests. These tests use X-rays, ultrasound, magnetic resonance imaging, or computed tomography to create pictures of your internal organs and tissues. They can show if your leukemia has enlarged your spleen, liver, or lymph nodes, or if it has caused any damage to your bones or other organs. Now, how is leukemia treated? The treatment of leukemia depends on many factors, such as the type, the stage or extent of your disease, your age, and overall health. The main goals of treatment are to kill the leukemia cells, prevent or treat complications, relieve symptoms, and improve the quality of life. The main types of treatment for leukemia are: Number 1. Chemotherapy. This is the use of drugs that kill cancer cells or stop them from growing. Chemotherapy can be given by mouth, by injection into a vein or muscle, or by injection into the cerebrospinal fluid. Number 2. Targeted therapy. This is the use of drugs that target specific features or markers on the surface of the leukemia cells. Targeted therapy can block the signals that tell the leukemia cells to grow and divide or cause them to die. It can be given by mouth or by injection into a vein. Number 3. Immunotherapy. This is the use of drugs that stimulate or enhance your immune system to fight the leukemia cells. Immunotherapy can be given by injection into a vein or under the skin. Number 4. Radiation therapy. This is the use of high-energy rays or particles to kill cancer cells or shrink tumors. Radiation therapy can be given externally from a machine that aims the rays at a specific area of your body, such as your spleen or brain, or internally from a radioactive substance that is placed inside your body near the cancer cells. Number 5. Stem cell transplant. This is a procedure that replaces your diseased bone marrow with healthy stem cells from a donor. Stem cell transplant can be done after high-dose chemotherapy or radiation therapy to destroy all of your bone marrow cells, including the leukemia cells. The donor stem cells can come from a matched sibling, an unrelated donor, or umbilical cord blood. Stem cell transplants can cure some types of leukemia, but it also carries a high risk of complications, such as graft versus host disease, infection, and bleeding. The outlook for people with leukemia varies depending on the type and stage of the disease, the response to treatment, and other factors. Some types of leukemia have a good prognosis, while others are more difficult to treat. However, advances in medicine have improved the survival rates and quality of life for many people with leukemia. Thanks for watching.